The major endocrine glands and their hormones. The endocrine glands include the pituitary gland, the pineal gland, the thyroid gland, the parathyroid glands, the thymus gland, the adrenal glands, the islets of Langerhans of the pancreas, the ovaries in women, and the testes in men. The anterior pituitary gland, its hormones, and some disorders. The pituitary gland is also called the hypophysis. A small gland about the size of a pea. Some of its hormones affect the functions of many other endocrine glands such as the testes, ovaries, the adrenal cortex, and the thyroid gland. It is situated in a depression of the sphenoid bone below the hypothalamus of the brain. It is divided into two lobes, a larger anterior pituitary lobe and a smaller posterior pituitary lobe. The anterior pituitary gland, its hormones, and some disorders. The pituitary gland is also called the hypophysis. A small gland about the size of a pea. Some of its hormones affect the functions of many other endocrine glands such as the testes, ovaries, the adrenal cortex, and the thyroid gland. It is situated in a depression of the sphenoid bone below the hypothalamus of the brain. It is divided into two lobes, a larger anterior pituitary lobe and a smaller posterior pituitary lobe. And the breakdown of fats and carbohydrates. It stimulates the growth of bones and muscles. If a young person suffers from too little GH as a result of abnormal development of the pituitary gland, a condition called pituitary dwarfism results. The person remains small, although body proportions are normal. The most famous pituitary dwarf was Charles Stratton, known as Tom Thumb, who was employed by P.T. Barnum in his circus. He died in 1888 at the age of 45 and was less than 1 meter tall. On the other hand, too much GH during childhood results in gigantism. Excess secretion of GH after childhood when bone has stopped growing results in acromegaly. Bones widen especially in the face, hands, and feet. However, in the majority of children, the anterior pituitary produces just the right amount of GH, resulting in normal growth rates. Checkups with the family doctor during childhood help to monitor the rate of growth and development. In the United States, it is now rare to see a pituitary dwarf or giant. Thyroid-stimulating hormone stimulates the thyroid gland to produce its hormone. The rate of TSH secretion is regulated by the hypothalamus, which produces thyrotrophin-releasing hormone, which stimulates the anterior pituitary lobe to secrete TSH. Adrenocorticotropic hormone stimulates the adrenal cortex to secrete its hormone called cortisol. ACTH secretion is regulated by corticotropin-releasing hormone CRH produced by the hypothalamus. ACTH is involved with the glucose-sparing EFXECD and helps reduce inflammation as well as stimulating the adrenal cortex. Melanocyte-stimulating hormone increases the production of melanin in melanocytes in the skin, thus causing a deepening pigmentation or darkening of the skin. Follicle-stimulating hormone stimulates development of the follicles in the ovaries of females. In males, it stimulates the production of sperm cells in the seminiferous tubules of the testes. The thyroid gland, its hormones, and some disorders. The thyroid gland consists of two lobes connected by a smaller band called the isthmus. The lobes are situated on the right and left sides of the trachea and thyroid cartilage just below the larynx. It is a highly vascular, large endocrine gland covered with a capsule of connective tissue. It is made up of spheres of cells called follicles. These follicles are composed of simple cuboidal epithelium, which produces and secretes the thyroid hormones. Thyroid output is regulated by the hypothalamus, which signals the pituitary to release TSH to increase thyroid production. The parathyroid glands, their hormone, and some disorders. The parathyroid glands are four glands about the size of raisins that are embedded in the posterior surface of the thyroid gland. Figure 12.5. There are two in each lobe of the thyroid, a superior and an inferior gland. Each gland consists of many tightly packed secreting cells called sheath cells and oxyphil cells close to capillary networks. The parathyroid glands secrete a single hormone called parathyroid hormone or parathormone. PTH inhibits the activity of osteoblasts and causes osteoclasts to break down bone matrix tissue, thus releasing calcium and phosphate ions into the blood. Ultraviolet light from the sun acting on the skin is necessary for the first stage of vitamin D synthesis. The final stage of synthesis occurs in the kidneys and is stimulated by PTH. Vitamin D can also be supplied in the diet. An abnormally high level of PTH secretion is known as hyperparathyroidism and can be caused by a tumor in the parathyroid gland. The pineal gland and its hormone. The pineal gland or body is a small pine cone-shaped structure found between the two cerebral hemispheres attached to the upper part of the thalamus near the top of the third ventricle. Figure 12-8. The pineal gland produces the hormone melatonin, which is secreted directly into cerebrospinal fluid. Melatonin has a number of effects on the body, and research continues on the hormone. It inhibits the secretion of the gonadotropin hormones LH and LSH from the anterior pituitary gland, thus inhibiting the functions of the reproductive system. Bright light inhibits the secretion of melatonin. Studies have indicated that melatonin regulates circadian rhythms. In bright light, with little melatonin, people feel good and their fertility increases. High levels of melatonin produced in the dark cause individuals to feel depressed and tired, bringing on sleep. Melatonin affects our sleep-wake patterns and maintains our biological cycles. Nerve impulses originating in the retina of the eyes send light information to the pineal gland. In dark or dim light, nerve impulses from the eyes decrease and melatonin secretion increases. Melatonin also plays a role in the onset of puberty and in the female reproductive cycle. Serotonin is also secreted by the pineal gland and acts as a neurotransmitter and vasoconstrictor. It stimulates smooth, the pineal gland and its hormone. The pineal gland or body is a small pine cone-shaped structure found between the two cerebral hemispheres attached to the upper part. The posterior pituitary lobe consists primarily of nerve fibers and neuroglial cells that support the nerve fibers, whereas the anterior lobe is primarily glandular epithelial cells. Special neurons in the hypothalamus produce the hormones of the posterior pituitary lobe. THSA hormones pass down axons through the pituitary stalk to the posterior lobe, and secretory granules near the ends of the axons store the hormones. See Figure 12-2. Antidiuretic antidiuretic hormone ADH, also known as vasopressin. Vasopressin maintains the body's water balance by promoting increased water reabsorption in the tubules of the nephrons of kidneys, resulting in less water in the urine. If secreted in large amounts, ADH can cause constriction of blood vessels, hence its other name vasopressin. The deficiency of ADH can result in a condition known as diabetes insipidus. Individuals with this condition produce 20 to 30 liters of urine daily. THC can become severely dehydrated. THC lose essential electrolytes, resulting in abnormal nerve and cardiac muscle functions. TH's condition can be treated by taking ADH as injections or in the form of a nasal spray. Again, the hypothalamus regulates ADH secretion through osmoreceptors that detect changes in the osmotic pressure of body fluids. Dehydration, caused by lack of sufficient water intake, increases blood solute concentrations, and these osmoreceptors signal the posterior lobe to release ADH. TH causes the kidneys to conserve water. Conversely, taking in too much water or drinking too much fluid dilutes blood solutes, inhibiting ADH secretion, so the kidneys excrete the more dilute more water in its urine until the concentration of solutes in body fluids returns to normal. In contrast, the diuretic increases urine secretion. Oxytocin OKCTOH stimulates contraction of smooth muscles in the wall of the uterus. Stretching of uterine and vaginal tissues late in pregnancy stimulates production of OT, so that uterine contractions develop in the late stages of childbirth. OT also causes contraction of cells in the mammary glands, causing milk ejection or lactation, forcing the milk from the glandular ducts into the nipple during breastfeeding of the newborn infant.
Many of the body's most basic functions are regulated by the endocrine system, 8 different glands located throughout the body. The endocrine system constantly and quietly does its work, secreting liquid chemical messengers called hormones. These chemicals manage muscle growth and digestion, as well as energy, reproduction,